Well, good evening, Facebook friends. I'm Dr. Nancy Stanley, physical therapist, life and health coach, and I'm here tonight. This is night 4, day 4 of my 7 days of free health coaching. And I've been talking a lot about insulin, diabetes, how to prevent it, how insulin and high glucose levels affects your sugar. So I'm looking forward to this tonight because this, I think, is going to really help you to identify where you are in the process and maybe even help you to relate to your children, your grandchildren, and give them some information. So I hope you'll share this video. I hope you'll tag your friends. Hey, Cecilia, thank you for joining me. I hope you'll tag your friends because this is it's such vital information. I just, when I really get sad and heavy-hearted when I'm sharing this because I'm thinking every day there are just more people, more and more and more people headed through these stages. So I'm going to talk about tonight the 4 stages of the progression toward diabetes and how you can arrest it. But what I'm hoping is that if you know and you can focus on maybe what stage you're in, or maybe what stage your child is in, or maybe if you are the child, then maybe you can pinpoint what is wrong, because people progress through these stages at different speeds. Hey, Tracy, thank you for joining me. Yeah. Different people go through the stages at different speeds. And so one person may be, take 10 years to get to stage 2 or 3. And other people, it may take them 20 to 25 years. And here's what really concerns me so much is people go to the doctor and the doctor says, well, your blood sugar's fine, your cholesterol's up a little bit, your A1C is good, your blood, and so everything's fine. But you're adding weight and you're taking in a lot of carbs and a lot of sugar. And so let me get to the task at hand and explain this a little bit more, okay? So it's never coincidental that somebody gets diabetes. It's not just, oh my gosh. Now, type 1 diabetes is not what I'm talking about here. I'm talking about type 2. But some of these principles I'm going to talk about controlling your insulin, applies to type 1. And there's been a lot of myths about managing type 1 diabetes even, okay? So you're gonna see some breakthroughs in that in the near future, I think. But most medical doctors are not educated on preventing or actually reversing diabetes. They're educated on medications for diabetes. So if your A1C is a certain level, then they're going to start you on some medicines, maybe even insulin. But they're not educated on what to do, or maybe they just don't have the time. They're not going to sit down with you and go over a nutrition plan, and they may send you to a dietitian, but most dietitians, in fact, not many that I have met, actually understand about how to manage your carbs and keep your body from producing insulin. That's what we're going for here. So last night I talked about a pretty controversial subject about exercise and the fact that exercise doesn't help you get rid of fat. Exercise helps you build your muscle. So go back and listen to that one if you didn't hear it, and call me or message me if you want to talk about it. But we've got a lot of wrong information out there. I talk to people every day that have the wrong information. They think if I just cut my calories or if I work out harder that I'll be able to do it, but it doesn't work that way. And if you're on here and you've done my program, please hit the love button or comment and say counting carbs and fasting works, because it worked for me. Okay, so as we go through this, you may recognize that these stages, in fact, you will recognize these stages. So, and maybe you can do something that will stave off the diabetes. And some people can stave it off with exercise and good sleep and even maybe genetics. But many people, it's going to jump on them, and then the next thing you know, they're like, oh my gosh, how did this happen? Okay, so let's start. So my question is, are you headed toward diabetes? And as I go through this, you'll be able to recognize some of these stages. So at the age of 65, which I'll be 65 this year in October, 77% of adults are either pre-diabetic or diabetic. Think about that. That's almost 8 out of 10 adults are pre-diabetic or diabetic. That is astounding to me. Okay, so here are the stages. Here's kind of how it happens, all right? So stage 1, you're a kid, you grow up in a family, and maybe y'all have dessert every day. There's always cookies available, or throughout the day you're having a snack, which is usually something with sugar in it. Okay, you get sodas frequently. You're drinking sodas frequently. I've had people join my program that said they were drinking 9 Cokes a day. I can't even imagine, but a lot going on with their. Hey Tiffany, thank you for joining me. All right, so maybe you ate cereal throughout the day. You ate cereal for breakfast, or you ate a Pop-Tart, or you ate, I know that's what I fed my kids a lot, toaster strudels, or things that just were very complex carbs, okay? Not eggs and bacon, okay? We did that some, but not a lot. You ate fast food, I call it TID or BID, twice a day or 3 times a day. Mexican food, which is a lot of carbs, you ate that. And then you would have more cereal, and you thought, well, this is okay because I'm getting the milk with it. So this was childhood, okay? So that was stage 1 up through your teenage. And you began maybe at the end of the teenage years to have some weight gain, all right? So this is stage 1, okay? Now we're going to go to stage 2, which is the college to 30s. All right, so you're doing these things. You're eating cereal probably a couple of times a day. You're eating fast food. You're having sweets. You're drinking lattes, which are loaded with carbs. Even the sugar-free ones are loaded with sugars. And then maybe you add beer and alcohol onto that, or just more quantity of that. And maybe you were playing ball in sports, but now you're not doing that. So you're not exercising, okay? And you really thought that this was healthy, but so here you are in college. You notice that you're tired more. I hear young people all the time saying, I'm tired. I'm like, I have so much energy. And then I hear them saying they're tired at that young age, and I'm just like, what is that? Well, this is what it is. Let's see, what did I say here? They're tired more. They're having insomnia. Maybe they're doing a little bit better with their food, but they're having trouble sleeping. With women, young ladies, they are having menstrual problems. They're a lot of hormonal issues are coming in, and they're starting to put on weight, okay? All right, then we're going to move down to stage 3, which is when your waistline starts to go. This is 35 to 40. You start noticing that you can't buckle your pants. You went from a 30 to a 33 or 32, or you went from a 6 to a 10, and you're just wearing loose stuff, okay? Men, I call it the Tommy Bahama look. They start letting their shirts hang out, okay? Because they don't want to tuck them in. And the women start wearing maternity wear, or loose tops is what I call it. I hated those tops, okay? I actually got on one of those now, but it's not as big as those other big ones that I had to try to cover up my fat. Okay, so you got a job maybe, and you've been on diets that seem to work for a little bit, but they don't work long term. Maybe you join the gym thinking that if I just exercise harder, but then you stick with these same habits, so nothing really changes much, okay? All right, and then So the doctor mentions maybe you happen to be at a health screening somewhere or something happened, and the doctor mentions that you maybe you're pre-diabetic. Okay, he may mention that maybe your blood levels came back a certain way, and or maybe your blood pressure went up, or maybe your cholesterol was up. Okay, or maybe you got your finger stuck at some kind of health screening, and you noticed that your blood sugars were high. Okay, so he might mention losing weight, but probably not. So this stage 3 is the 40 to 60 year age. Well, actually, this is the 30 to 40, and then stage 4 becomes the 60-year-old stage, and here's what happens there. But before you get to that, you're developing. Here's what you're seeing. You're seeing a diagnosis of fibromyalgia, Hashimoto's. Your energy is low, and you've just sidelined. You're not really, you're having the grandchildren over, but you're not really enjoying them because it's such a chore. You're not cooking meals anymore. And so things are just really moving in the wrong direction. And it's all about insulin. And you think, well, insulin is a good thing, but when you eat carbs, your body secretes insulin. And as soon as insulin is in your body, whether you put it in with a syringe or you take in sugar and your body produces it, you stop burning fat. You cannot burn fat when insulin is up in your body. So just know that, and that should help you kind of understand. And I'm going to teach you tomorrow what the foods are and what some of them are that really are insulin bombs, okay? All right, so then you go to the doctor maybe at 60, and he starts talking about maybe you should lose weight. Your A1C's up, your blood pressure's up, and so you've tried other things. You've tried fasting maybe you tried the keto diet, maybe you've joined the gym. You've tried all these things, and nothing seems to be working long term. Okay, all right. So here is the good news. I'm about to give you some good news. Okay, so I want to talk just a little bit more about why medicine doesn't work. Why you take these medicines, you go to the doctor and he gives you these medicines, metformin and different ones, but you notice that every time you go, you're getting more medicine. And your A1C is going up, it's not going down, and you're gaining weight and you're feeling worse, and there's just a lot of reasons for that. So in stage 3, the doctor's going to start discussing weight with you and maybe sending you to a dietitian. But what's happening here is usually once you get to the insulin stage, here's what they'll tell you. At type 1 and type 2s, they'll tell you to match your insulin with what you're eating. So if you want to have a piece of cake, then bolus your insulin. Well, here's the problem with that. Insulin causes damage to your body. I mean, it's a proven fact. Statistics show it. And here's what long-term exposure to insulin. That's why no one needs more insulin. No one. You just need to adjust your nutrition. Yeah, hit the like button if you understand what I'm talking about. So number 1, insulin increases your risk of cancer. Number 2, insulin increases your mortality rate. Number 3, it increases your risk for cardiovascular disease, which is stroke and heart attack. Number 4, it increases weight gain, and that extra weight is going to cause problems with your knees and your hips and your mobility and just so many things. So need I say more about the value of keeping your sugar, your blood sugar low so you don't have to take insulin or make insulin, okay? Hey, Anita. Hey, Dee. Good to see y'all. Thank y'all for joining me. Please share this video. Okay, so here we go. Now we're going to talk about metabolic syndrome. You may be hearing those words if you're at the doctor's office. So here's what that is. That's an increase in triglycerides. It's these 5 things. An increase in triglycerides, an increase in fasting blood glucose, an increase in your waistline, a decrease in your LDL cholesterol, and an increase in your blood pressure. So If you have all those, that's what you have. The downside is that all of these are chronic illnesses. And the way we treat chronic illnesses in our medical world is with medication. But if we could get it on the front end before it comes, we wouldn't need the medications. Okay, so that's what I'm going through. So the good news is that you can cure diabetes. There is a cure. And what is the cure? It is the right nutrition. Now, type 1, it's not a cure for that yet, but I'm going to put in my email that's going out tomorrow. So if I don't have your email, be sure I get your email. I'm going to put 2 links to 2 videos of 2 type 1 diabetics that have gone through my program that have lowered their insulin almost to nothing. And they have lost weight, 25 pounds. One's 25, I think the other one's 35 pounds. They're having more energy. They just feel better than they ever have, okay? And then I think I'll also put a link to a couple of type 2 diabetics that I've had that have come off of their insulin totally, no more insulin, okay? One of my patients was on insulin for 25 years. She's come off of it. She's lost 25 pounds. I think now she's lost 40 pounds. And she is so excited because she feels so much better. Okay, so give me your email, put it in the comments, and I may even put these links to these videos in the comments so you can see them. I may just post them on my page. But anyway, share all of this information because it's life-changing. Okay, so tomorrow, stay with me because tomorrow night I'm going to talk about what is the diet, what is the program, and I'm going to explain something really, really important, excuse me, that I've never talked about on one of my programs, but I'm going to talk about fructose. Fructose is what they call it, and what you need to be looking for with fructose. And then I'm going to give you the 61 different names for sugar, because did you know that there are many people that are thin, that have, thin, not overweight, not obese, that have non-alcoholic fatty liver disease. And it is from the fructose, and it's also related to diet drinks. So you want to stay with me, hear that tomorrow. And hey, Jackie, thank you for joining me. Please share this video, and let's talk soon. Have a good night.